Hello, everyone. Good morning. I'm Professor Kevin Fenton, the President of the Faculty of Public Health. It gives me great pleasure to welcome you here this morning for the faculty's distinguished lecture on the future of public health. And where senior public health leaders working here in the United Kingdom and around the world discuss the changing nature of our profession. Now, if you've been following the series, you know that this is the sixth lecture in the series, with previous sessions having been delivered by Professor Dame Jenny Harries, Professor Linda Bald, Dr. Maria Nera from the WHO, Professor Sir Chris Whitty, and Professor Kamara Jones from the United States. It's been a fantastic series of lectures, which are all available through the Faculty of Public Health's website. Now, as with all of our distinguished lectures, you'll be hearing today from our distinguished speaker, Professor Sir Frank Atherton. We'll have a chance for a question and answer following his presentation, and then we'll be hearing from respondents who I'll be introducing during the course of the session today. Because we want this to be as interactive as possible, please use the Q&A function or the chat if you'd like to ask questions to any of our panelists today, but especially to our distinguished lecturer, Frank Atherton. Now, public health is political, but then so is the environment, so is health, so is education. Politics interfaces with our day-to-day lives in so many ways. We are now seeing where politics and public health are intersecting once again. Geopolitical changes happening in the United States having an impact around the world. The impact of the economic crises that we find ourselves in, resulting in challenging decisions being made about the role and size of government and ultimately the role, size, and functions of public health within society. Now, with concerning trends away from evidence-based policies happening in countries around the world, coupled with widening inequalities in health outcomes, certainly across our country, there's a need for us to begin thinking about what is public health in the 21st century, now more than ever. So, today, I'm just delighted to welcome and to introduce Professor Sir Frank Atherton, who is the immediate past Chief Medical Officer of Wales. And Frank will be reflecting with us today on the lessons learned throughout his career, and specifically lessons related to navigating policy challenges and delivering public health in constrained systems here in the United Kingdom and overseas. Now, many of you will be aware that Frank took up his post as Chief Medical Officer for Wales in 2016, having worked in hospital and primary care systems around the north of England for a number of years before undertaking voluntary work as a district medical officer in Malawi. On his return to the UK, he completed specialist training in public health in the Yorkshire region and then worked on international health and development issues for the World Health Organization and the Department of Health, Department for International Development in various locations, including the former Yugoslavia, Tanzania, and Bangladesh. Frank has also previously worked as Director of Public Health in Lancashire, served as President of the ADPH between 2008 and 2012, and was Deputy Chief Medical Officer in Nova Scotia in Canada. Frank was knighted in 2022 New Year's Honours List for his services to public health during the COVID-19 pandemic. Frank, welcome. We're so pleased to have you here, and over to you.
Well, thank you very much, Kevin, for that wonderful introduction. And Borodar, good morning, everybody. Really pleasure to be here. I'll just start sharing a few slides, if I may. Here we go. Hopefully you can see those. Can somebody just check that you can see those? Let me know.
Yes, we can. Perfect.
Okay. So what I wanted to do today, Kevin, if that's okay, in a short time, is just to kind of talk a little bit about poets, pestilence, and politicians. I chose the title matching what you'd asked me to speak about, but also obviously a bit of splendid alliteration there. It will be partly travelogue. I'll talk about some of the places I've worked as a public health specialist and some of the things I've learned in those places. Partly, I will of course reflect on the pandemic, as that's still firmly in our minds, and of course I will, as you suggest, Kevin, talk about the political dimensions of the work we've been doing. I'm also going to touch on some of the lessons I think that we need to learn for public health, and And I'm also going to finish up by perhaps thinking a little bit about transitions and how we manage transitions in our lives. And I do have an ask for people, so watch out for that at the end. So let's get started. And of course, my screen doesn't move on. There we go. I'm just going to shift to another screen. Typical. Sorry about that. And there we go. Okay, so my Damascene moment, I suppose, came with my move to Malawi. I trained in medicine in Leeds at Leeds, and had stayed in the Yorkshire region for quite a while. Worked up in Newcastle and became a GP. But I never settled into life as a GP. Had itchy feet, and so I signed up with VSO and went to work in Malawi, and that was where I really became interested in public health. I didn't really know it as public health at the time, but I was running as quite a young doctor. I was running a district, working in the hospital, working around the district in various health centres and dispensaries, supporting staff there. And it was really the issue of maternal mortality and the terrible state of young women, young girls really being brought in extremis from remote areas of the district that led me to think about public health and about how prevention and all of the terrible damage we were seeing to these young girls was something that could be entirely avoided. So it's interesting as well. I was going to talk about politicians. The gentleman, of course, on the right is Hastings Banda, the then dictator of Malawi. I was once his personal physician for a day when he came to do a crop inspection. A very repressive regime, of course, and it's interesting to reflect on the fact that he had trained, of course, as a doctor in the northeast of England. He worked as a GP up there and in London, and it kind of makes me think about the way that some members of the medical profession have perhaps uh, become monsters over time. I'm thinking also Bashar al-Assad, you know, and the who trained as an ophthalmologist here. So an interesting time to be in Malawi. But my spark of public health was ignited when I worked there. And I'm not going to show lots of statistics, but this is actually something that I'm really delighted to see and to present, because over the course of my professional career, maternal mortality in places like Malawi have dropped like a stone. I mean, it's still far too high, of course it is, but it dropped right down from 800 per 100,000 down to less than half of that. And so that big gain that we've seen in maternal mortality is something that we should be very proud of, I think, and we should be very protective of. And of course, it's a very difficult time geopolitically at the moment, given that we're at a time where the world's richest man has taken away a lot of the protections and the things that led to those reductions in maternal mortality. So I think we need, as a public health community, to think about how we can kind of protect those in the current environment. But my time in Malawi was short. It was only 2 years. I returned to the UK and retrained in public health. So this is a picture of Stanley Royd Hospital in Wakefield. And in August 1984, there was an outbreak, a large outbreak of salmonella in this institute, which had become, it was an old psychiatric hospital, but it had become over time the living place for elderly, frail people who had previously suffered from psychiatric illness. So it was their home, basically. But there was a huge outbreak of salmonellosis. Uh, Food controls were not what they should have been. Over 350 patients were affected, 100 and odd staff were affected, and there were 19 deaths. And it led to a major outcry in the UK. And that, along with an outbreak of Legionnaire's disease, led the then Chief Medical Officer, Sir Donald Atchison, to produce his report on the state of public health. And what happened then, of course, was that there was a huge input of resource, money flowed into the system, and a lot of former GPs like myself took advantage of that and were able to retrain in public health. And that's the kind of first kind of poetic theme that I wanted to mention. Here, of course, is the bard. William Shakespeare, and my first kind of poem is well, it's the narrative from Julius Caesar, of course, where Brutus is trying to persuade Cassius to help assassinate Julius Caesar. There's a tide in the affairs of men to which taken at the flood leads on to fortune. Omitted, all the voyage of their life is bound in shallows and in miseries. On such a full sea are we now afloat, and we must take the current when it serves or lose our ventures. And to me, that's always something that I've kind of borne in mind, because I think we have to seize the moment. And when we have these crises in civil society, and certainly in health of our population, that tends to be the moment when we see investment in public health and when we should be arguing for it. I'm going to talk about the pandemic later, of course, but the issue, of course, around the pandemic is I really genuinely thought that would be a greater investment in public health after that. That didn't happen. That hasn't happened for reasons that we'll talk about probably later. But I was fortunate. I seized the current, and I was fortunate I was able to retrain in public health. Here's a confession, Kevin and colleagues. I never actually finished my public health training. I was distracted, and there was a war in former Yugoslavia, and I went to work through DFID, but with WHO. I worked with a couple of colleagues in former Yugoslavia doing health needs assessment work around the war-torn areas. This, of course, is Mostar Bridge, which was destroyed during the time I was there, and has now been, very pleased to say, has been rebuilt. But it was a brief time in my career. It was sufficient to convince me that my interest lay in long-term development rather than short-term relief work. And I think many of us have to make those choices at some point during our careers. But it was also a huge reminder that peace is an absolute requisite for public health. And of course, we're in a time now, a challenging time, where we've got war in Ukraine, war in Gaza, a dreadful war in Sudan, South Sudan, looking very problematic, the DRC kind of erupting, and we need to always remember that peace is the first cornerstone of public health. You'll be pleased to know, Kevin, I did get retrospective recognition while I was subsequently in Tanzania of my training. So I am accredited. You don't need to phone the GMC and report me as not having completed my CCT. So that was all done. I moved on subsequently through, as I say, I'm not going to talk about my time in Tanzania, but in Bangladesh. I put this slide up because it's quite meaningful to me. The boat there, the large boat in the middle, is the original river boat which went up and down the Jamuna River. This is the Jamuna at a place called MATLAB, which is a field station for ICDDRB, the International Centre for Diarrheal Disease Research, Bangladesh. And that was the boat which actually conducted early cholera trials up and down the villages. The little speedboats, the easiest way to get to MATLAB is to go up the River Jamuna on those speedboats. And so it's a kind of mecca for public health activity. ORS trials were also done there. And those are the technologies, the type of technologies which have saved millions of lives, of course. My job there was working with a consortium of donors on a multi-million-dollar program to build the health and social care services in Bangladesh. But the political dimension was really quite interesting. These two ladies on the right, you have Sheikh Hasina, recently deposed, of course, as the Prime Minister of Bangladesh, and opposing her on the left is Khalida Begum, who was the head of the Bangladesh National Party. And these two women, for historical reasons, had deep and bitter hatred for each other. And what was tending to happen in Bangladesh in those days was that there was a flip-flop of government. Every time there was an election, it would flip from the Awami League back to the BNP, and then back to the Awami League at the next election. And we as donors didn't really recognize the political dimension to that. So we were happily supporting things were moving in a very good direction, building new hospitals, training staff, etc. health indicators were all moving in the right direction. But there was a change of government, and the new government necessarily saw everything that the old government had been doing, including its work with donors, as evil. And so the whole program, the whole multi-million pound, billion-pound program, was actually paused for a while. So things went backwards again. Of course, they didn't go completely backwards. I believe there's a kind of sawtooth pattern to development in many of the countries that we've worked in, but that was a very challenging time and taught me something about the importance of recognizing the politics and working with the politics. After Bangladesh, I returned to Morecambe Bay as Kevin, where I was the director of public health in Morecambe Bay. The primary care trusts were just being set up. I was brought up in Morecambe. I wasn't born there, but I was brought up in Morecambe. And there is nothing better than being the director of public health and serving your local population. It was a fantastic time. I spent 10 years there, and I put just two pictures up because they were seminal moments. So the top left-hand picture is a place called Forum 28. It's in Barrow-in-Furness, and it's the place where, on the second day of my job as a director of public health, there was a recognition that there were two linked cases of Legionnaire's disease, and the Forum 28 was the place that I originated in, and that, I think, to this day is still possibly the biggest outbreak of Legionnaire's disease. Day two, it was a kind of baptism of fire. Very, very interesting time. And the bottom picture, of course, are some of the Chinese cockle pickers who, a couple of years later, in 2004, were sadly out on the sands picking cockles. They were illegal immigrants. They'd been trafficked into the northwest of England, didn't know the sands, and sadly, 21 of them died. Probably two others, one never found. And it was a real eye opener to us, because these were people living in our community. They were living quite, it's a little place on the map called Hest Bank. You can actually walk across from Hest Bank to Grange over Sands if you have a guide, but the currents are wild. It's the second highest tidal range in the world, the largest being in the Bay of Fundy, which I've also worked in. But it was a reminder that inequalities are sometimes hidden right in front of us, and it was an absolutely shocking time, shocking event. I'm going to skip over the time I spent in Canada. I learned a lot of things there, but I did return to Cardiff, as Kevin has said, in 2016 to be the CMO. And one of the things which I'm very often asked is, how do you get to be a CMO? And I often say, well, a lot of it is serendipity. Timing is everything. Being in the right place at the right time. Obviously, having a public health qualification is not a necessity, but it's certainly an advantage to people to have that. But also having broad experience of working in different communities, different healthcare settings, is something that you should think about if that's the trajectory you feel you want to be on. I'm going to talk about the pandemic in a moment, but before I do that, it wasn't all about the pandemic, and I just kind of highlight here some of the annual reports that we produced, me and the team in Wales over the last few years, and just to highlight a couple of them, because I think they have resonance. One was back in 2016-17. It was the Gambling with Our Health, and it was at a time when I didn't really believe that in the UK we were taking gambling as a public health issue very seriously. Of course, subsequently there's been a huge amount of effort, and I'm really delighted to see a lot of academic interest in this, and a lot more focus on gambling, the harms that come with gambling. I'd become interested in this during my work in Canada, actually, and I'd been a board member for a committee which took money from the gambling industry and redistributed it for research, for treatment, etc. In rather the same way as we now are going to have a system in the UK. So I was really interested in this issue. Just an interesting aside on this one. The picture on the front, I had a huge argument with my colleagues in the communications team here in Welsh Government. They said, well, kids don't gamble, they can't go in casinos, but it's an impactful picture, I think you'll agree. And but I had a devil of a job to try and persuade them that it should go ahead. But in the end of the day, I was able to put my foot down and say, this is my report, this is not a government report. I don't need your permission. And I went ahead with it. And sometimes, I suppose the lesson there is, yeah, you have to pick your arguments in life, don't you? But sometimes you should stand firm for your principles. The other report, which I'll just highlight, is last year's. It was actually 2023, but published in 2024, and it was on shaping our health. And that was a report which I drew on experience of others and pulled together my thoughts, our thoughts in Wales about the commercial determinants of health. And again, it's an issue which has clearly kind of reared up the public health agenda, and I'm really delighted to see a lot of work going on around commercial determinants now. So really positive. So I think the power of public health reports are not to be underestimated. So as I promised, Kevin, I'm going to talk a little bit about the pandemic because it was, a major feature of my time as CMO here. I've been 8.5 years, and I suppose half of that time was dominated by the pandemic from 2020 through to 2023, 2024. And we're still seeing the tail end of the consequences of that now, of course. And it'll be no surprise there were huge downsides in terms of the direct impacts, the mortality, morbidity, the overloaded NHS capacity that we're still struggling to catch up with, the treatments that were missed and delayed, and of course the social and economic harms, the lack of schooling, loss of schooling, and the impact on children, young people, etc. And you were right in your introduction, Kevin. One of the things I said when I came to Wales was that I was looking to help to drive better health, but also to narrow health inequalities. And we haven't done that. We have not done that. Inequalities are widening, and partly as a consequence of the pandemic, partly as a consequence, of course, of the wider economic situations that we find ourselves in the UK. But there were some surprising positives as well. We had a sense of common purpose. I was very proud of the way that the public health community in Wales and across the UK worked. We worked very collectively, I think, as chief medical officers across the four nations and the deputy chief medical officers. Great to have Nicola with us a little bit later on. I felt that we managed to kind of get away from the roadblocks in thinking and decision making, which plague, let's be honest, the NHS in particular, and that the speed of decision making was very rapid. I do feel we've slightly gone backwards, and that the concrete is setting slightly on our ability to think and move and innovate quickly. And of course, it was research, and the research, particularly into the vaccines, which came to our rescue in all of that. At the end of the day. So some of the lessons that I took away, and followed the science was the mantra, wasn't it? But the science is always contested. There's always a different view, and that's fine. Everybody is entitled to an opinion, but we should be respectful of each other as we raise those opinions. I think we did have quite a good architecture of advisory systems. I felt it was very useful having the independent sage looking from an outside and bringing different ideas to bear. There were lots of offers of help at micro level in terms of making PPE, etc. They were always welcome, but sometimes, of course, they got in the way of the large scale response that we needed. The one I would focus on is the communication. We did quite well, I think, in Wales in terms of communicating with the public. A lot of my time was spent on communication, but you can never assume that the message given is the message that's delivered. And I remember one case, somebody phoned up and it came through to one of my deputies actually, and the question was, it was a teacher, I think, who was phoning, who said that she had done a COVID test, but one of her nostrils had tested positive and the other had tested negative, and what should she do? And we can't assume that the public kind of understands or knows how to do these things. So never make assumptions about communication. I also I think there's something that we need to learn about the legislative framework that we have in public health. Of course, the 1984 Public Health Act was used to a large degree for the restrictions that we put in place, rather than the Coronavirus Act. I felt that it used inappropriately on some occasions. It was a difficult framework, and I'm sure one of the recommendations from the COVID inquiry will be about updating our legislative framework. And the other really big message, I think, for us is that in a way, efficiency is the enemy of pandemic preparedness. So the fact that we run the NHS so hot in the winter time means that there's very little capacity. So when we found ourselves in need of ventilators, when we found ourselves in need of extra hospital beds, of course, we had that business of building the Nightingale hospitals, but we had to do that on the hoof. And it's one thing to be efficient, but you need redundancy in the system if you're going to be really effective in managing the shocks to the system that are inevitably going to follow. The public inquiry, of course, still is rumbling on. And I often contrast the situation in the UK with the situation in Sweden, which where their pandemic inquiry was finished in record time, of course, in a matter of months rather than years. Ours, I think, will roll on till next year. It's important we learn the lessons, of course it is, but we have to recognise that many people lost loved ones, were personally very directly affected, and they need an outlet for their the problems and the issues they've faced. But I think it's really important that inquiries, and we do go through a lot of public inquiries in the UK, but they start not with a fixed view, but with open minds. And I do feel that sometimes inquiries have a fixed view starting point, which they're trying to prove, rather than going into anything with a spirit of open inquiry. And sometimes they descend into mere sensationalism. This is just a little clip from during the pandemic. I didn't keep a diary or anything. I just kept um, a day book where I just used it to kind of organize my thoughts when I was going off to brief ministers, etc. But but they had to be submitted to the inquiry, and they picked out this particular page in this thing because I've written the word omnishambles, and they asked me to, they probed as to why I'd written that word. And of course it was hard to remember why I'd written it, but it was just a personal kind of thinking rather than anything formal. But there can be a descent into sensationalism sometimes. Kevin, I'm short of time, but I'm going to just talk very briefly about working in a political environment, because that is at the heart of what you do as a CMO and working in government. And one of the things I'm always struck by is the need for stability. And this is just a selection of MPs. I'm sorry, it says that the incumbent is Victoria Atkins. Clearly, she isn't. But so the slide is a bit old. But just to reflect on the fact that there are eight ministers of health at the UK level in England during this very brief period of time between 2018 and 2024, roughly 2023. And having such a rapid turnover of ministers makes it very hard. I mean, some of them were actually very good and very, very easy and very good to work with. Some of them were more difficult, and some of them were very, very briefly here. Theresa Coffey, for example, only a very, very short period of time during the Liz Truss period. And when I think of politicians, I sometimes think of William Butler Yeats as my second poet. This is from the Second Coming, of course, and it's a poem which has kind of followed me, I think, because it often resonates with some of the things I've seen in public health. Things fall apart, the centre cannot hold. And the last stanza, the best lack all conviction, while the worst are full of passionate intensity, is one that I often think about because it just resonates with me. So William Butler Yeats. Now the contrast with Wales, of course, was I felt we were very fortunate in Wales, and probably Scotland and Northern Ireland to a degree had the same thing, because we only had two ministers of health during that time: Vaughan Gethin, there, the gentleman, and Eleanor Morgan, who's now our first minister. So I felt we were fortunate; we had a more stable political environment to work in. Oh, excuse me. And I often think about how politicians get irritated. And this, of course, is John Prescott, sadly deceased now. He's a great speaker. I don't know if you ever heard him speak at various local events, but he was a very dynamic speaker and a very dynamic man. Two Jags, they used to call him, because he used to have two Jaguar cars, apparently. But this is a picture of him, I think, after he'd been assaulted with an egg by a constituent, and he'd been egged, and he then punched the egg thrower and became known as Two Jabs Prescott, of course, after that. But the the things which annoy politicians, I found, are, first of all, if we fail to deliver or we make false promises in public health. Secondly, if we confuse return of investment with cost saving. I remember Mark Drakeford, our then he was the Minister for Health here, and subsequently became the first minister. I remember him saying to me, you know, Frank, if I had if I followed all the advice of everybody who's told me that this intervention or that intervention is cost saving, I could run the NHS for nothing. So so you know, don't make false promises, don't overpromise, and the other thing which is really important with politicians is not to be too carping. You know, bring them solutions, don't just bring them problems. I know I'm getting close to the wire, but I'm nearly finished, Kevin. The other thing I wanted to mention was SPADs, special advisors. I found them extremely useful to work with in Wales. This is Dominic Cummings, of course, you know, so they're not always brilliant to work with, but they are extremely useful as a conduit to the politicians, to the political classes. So work with the SPADs if you can, get to know them and work with them would be my my clear advice. And my third poet is John Cooper Clarke. I can't tell you that in Polite Society the title of this, but you can probably figure it out or go and listen to it online. Well worth a listen. He's the only poet that I'm mentioning who I've actually met. I bumped into him in a restaurant in Cardiff, and a delightful chap, I have to say. So my top tips to work with politicians. First of all, avoid what I call the Jiminy Cricket. Public health sometimes, you know, is like the Jiminy Cricket figure. It sits on the shoulder giving advice, and advice is easily ignored. And so try and avoid that. Don't just sit there giving advice. Get stuck in. Clearly, we have to work the political cycle. Getting involved with politicians at the start of their tenure is quite important. I've already mentioned bring them solutions, not just problems, and understand their motivation, which ultimately, of course, is to get re-elected. A few things on the public health, what I've learned, clearly the domains I think still serve us very well: health improvement, health protection, health services, health intelligence as well. And I think adding political nous is really quite important. Follow the cycles of public health. We've already talked about. I've always seen public health and medicine in general as a profession, not just as a job. And I think it's quite important to make that distinction sometimes. And we are best when we remain coordinated and when we have a common purpose, common message. I think we saw that in the pandemic. We are at our worst when we are divided and fight among ourselves. So finally, the next chapter for me, I don't think about it as retirement. I think about it as demitting from office and going on to other things. I'm now a trustee for a charity, Freedom from Torture, very good charity. It has bases up in Glasgow, Manchester, and London, and provides services, but also campaigns for an end to torture, something I'm very passionate about. The picture at the bottom, when I left Welsh Government, I asked people not to have a whip round. That's the last thing I needed. But I asked people just to give me a recommendation for a book. And so this, to my wife's horror, is the Atherton Memorial bookshelf in my home. And so I've got a lot of books. And my ask to everybody on the call actually is, if you have a recommendation, for goodness sake, don't send me a book. I've got no space for them. But if you have a recommendation for a book that you feel I should read in my retirement or my period of reflection, then either send it through to the faculty or you can send it through directly to me. I'll give you my contacts in a minute. But my final poet is, because I think there's still work to be done. I don't see it as job done. And this, of course, is Anthony Burgess, better known probably as a novelist, but he also wrote huge amounts of poems. And I love this quote of his, because there's work to be done, wedged as we are between two eternities of idleness. There is no excuse for being idle now. We should take that as our public health mantra. So thank you very much. That's where you can send your book recommendations if you want to, either on LinkedIn. I don't use X or Twitter as was anymore for reasons that you can probably imagine. I used to have a Twitter handle, and there's some banging tunes on Dr. Frank's Medicine Chest on Spotify if you want to find those. Kevin, thank you ever so much. Such a pleasure to have this opportunity. Thank you.
Oh, Frank, congratulations. And thank you so much for for taking us through what just a very wonderful, reflective journey of your career and pulling out some of those nuggets that you've learned along the way, which is exactly the space that we wanted to be with this lecture today, because you've been, a fantastic colleague. I've known you for many years as well. Our lives have not physically crossed, but we've crossed paths and we've had a chance to work together, certainly through the pandemic and since. So thank you for your leadership and your work and all you have contributed to Wales and to public health globally. So, as you know, I have a few questions for you, which really build upon, I think, some of the themes that you started with today. And I think the first one that struck me, and I think especially from some of our younger members who are starting their careers, is the wonderful, what seems as an organic nature to your career in public health. And I wanted to understand from you, looking back, did you plan your steps meticulously, or were you that kind of person who looked for opportunities, did great jobs, and then the next opportunities opened up? Um, how would you describe your career? Was it one which, because I think that's one of the things people struggle with. Does it need to be super planned, or can you be organic? Can you take advantage? How would you tell your story in terms of your career journey?
Yeah, well, I would use the word serendipity, really. I think
Uh-huh.
I've been lucky, and no, it's never been meticulously planned. Absolutely not. That's not
Hmm.
my space at all. I've kind of followed my nose, and
Hmm.
sometimes, I've had to make difficult decisions. I remember when I moved off to Canada, I had three different options. I could have stayed as the director of public health of a new thing, the Lancashire public health system, or I
Hmm.
could have actually had an offer of a job in Ethiopia, working for Australian Aid, and I had an offer of a job in Canada, and juggling those things was quite difficult at the time.
Yeah.
So I followed my nose and my inclination. Um, yeah, it's about serendipity.
Mm.
You do need to have a degree of planning, I think, and I also think there's a degree of luck in things. And listening to other people, I've been fortunate. I had some great kind of teachers, some great leaders that I've kind of listened to. David Nabarro in international development was a
Yeah.
fantastic colleague to work with,
Mm.
and I'm still in touch with him, and it's a joy to kind of tap into his wisdom as well. So find yourself mentors as well, is a good thing. But the only other
Mhm.
thing I would say on that, Kevin, is too long is too long, and you do get stale in jobs. You do need to move on after a certain time, I
Mhm.
believe. I hesitate to say it, but I don't think 10 years is in senior public health jobs, you need a period of time to settle in. You
Yeah.
need a couple of years to become effective. But when you get to 10 years, what have you got that's new? And
Yeah.
I'm 8.5 years in as CMO, so now is the
Yeah.
time. Yeah, itchy
Yeah.
feet as well. Itchy feet are
Well,
quite a good thing.
well, I think you and I share that. My rule of thumb is when you're younger, stay in the job longer, but as you
Mm,
age, move, think about 5, 7 years as a sort of ideal time that you begin
mm.
to get your senior experience, and then you move on for impact and you keep growing. But I think it would be interesting to hear in the chat what people think about how do you keep fresh and how do you plan your careers. And then the second thing I was struck by is you really rooted this presentation in values. Um, and I think just to quote something that you said, which is understanding the spark for public health, what gets you interested in public health, and how those values underpin the work that you do. What are your values, Frank? And have they changed over time, or are the same ones that you had at 20 still the same today? And how do you understand your values changing? Uh,
Yeah, it's a great question. I don't see them radically different to how they were when I was younger. I went into medicine to make a difference to people's lives.
mhm,
I didn't go into medicine to make money. I mean, I've been well paid. In some of my jobs, I've done voluntary jobs and had no pay. So it wasn't about the money. It was about the difference I make. And let me say one thing, Kevin, because things make me. You try not to show it, but you have to have passion. You have to have, sometimes you have to be angry about the way things are.
mhm,
But it's one thing to be angry, and it's another thing to show it really. So you have to kind of keep that outrage, that sense of outrage,
mhm,
that things should be better. And I
mhm.
think that you can't be outraged all the time, but you have to
Yeah.
see problems for what they are. And I was just listening to just before this lecture. I was listening. I love Desert Island Discs. I was listening to Lindsay Hilson was on, and she was talking about her time in Rwanda, during the genocide, which is just after my time in Bosnia. And she was talking about the really difficult things she's seen and the inequities and the horror that she saw. And we're still seeing lots
Mhm.
of that around the world.
Of
So
course.
it's all
Yeah.
right to be angry, but find a
Hmm.
way to channel the anger and
Hmm.
to make it better for people. Yeah, my values are not dissimilar to how they were when I was
Not
20.
dissimilar. And if we could stick with that theme on anger, because sometimes people see leaders as being sort of even keel, calm, getting things done and moving forward. But have you had to use your anger in dealing with politicians or in saying, actually, this is a line that I think I can't, it has to be drawn?
Mm.
How do you sort of allow that emotion within that political leadership space, or don't you? Uh,
Yeah, yeah. It's no point in getting angry with the politicians. It'll get you. It won't get you very far, really. So it's better to go and kick the waste paper bin rather than kick the politician. But yeah, I mean, sometimes they make decisions, but you have to bear in mind, politicians have to weigh up everything. They're not just what you're giving them as the best advice that you can construct. They've got to take the broader picture. They've got to think about the economic and social concerns and about how their voters are going to vote. So you have to be respectful of all of that. But when there are ways, aren't there? You're a past master at this. So, when politicians are doing, or on the verge of doing rather ridiculous things, there are ways of kind of steering the steering them, dare I say. And that's where the SPADs come in, because they know how to do this. So getting close to the SPADs again, is really useful to help steer the politicians away from disastrous decisions. Yeah.
yeah. Um, I want to reflect now a little bit on the lessons from the pandemic and how um, you think we can hold on to some of those lessons and create legacies. And I think you're right that I don't think we predicted that the shift back to the sort of reversion to type of systems would have occurred as quickly as it feels it has done. And I think with the changes that we're seeing in England, with NHS England, that may again force back that system focus on urgent and emergent rather than deeper systemic change, dealing with the wider determinants and so forth. Any words of advice from your career in terms of both recognizing the waves, but also locking in the changes after the wave so we don't go back to type? I guess that's a question about how we navigate that shift, those shifts.
Yeah, it's a great question. I mean, every politician will always say, we want. You hear the mantra in England, you hear it in Wales. We want to move to prevention. We want to move resources to the community, but there is a gaping maw of
Mhm,
the gaping mouth of secondary care, which will always be needed. And so it consumes more and more resource. And the way I've often thought about it, Kevin, is. You've got to it's that point about getting stuck in. I sometimes frame it as you've got to serve the beast in order to change the beast. You've got to
mhm,
get involved in the dirty, necessary work of how you shape health services so that you can derive better value and then liberate resource which potentially can move to public health. So it's that really, when money's plenty, it's okay. It's easy, isn't it?
mhm,
Because you can go and argue for the marginal resource and marginal resource will be come in. But there's no marginal resource at the moment.
mhm,
Things are very tight, and it's going to be the case for the next 10 years, really. So driving efficiency through the health system so there's more resource to put in. It's a really difficult time at the moment because the
mhm.
UK, along with other nations, clearly we're going to have to put more money into defence. There's
Defense.
absolutely no doubt, and it didn't surprise me that the international aid budget was the first to be cut. It didn't
Mhm,
really surprise me. It did surprise me a bit that that the cuts to welfare benefits came next. But I think there'll be a cut to NHS potentially, you know, because
Mhm,
we do have to put resource into defence.
mhm,
And what is our public health response to that? I think it's going to be quite a challenge for, not for you because you're demitting as president, but you know,
mhm.
I think there's a real question for the
That's
faculty about how we kind of manage that interface, because the world has changed and we need to change with it.
That's right. And that's a really nice point then to segue and hear from some of our other experts, which have joined us today to share their reflections with you, Frank, but also to help to stimulate some discussion with our members who are on the line. So just want to thank everybody for joining us for the session today. We've just heard from Sir Frank Atherton. Now, it gives me great pleasure to welcome our three respondents and panelists who will be giving their brief reflective responses as well. So I'm going to begin by introducing Professor Peter Kelly, who is my colleague in the Department of Health. Peter is the Regional Director of Public Health for the North East and Yorkshire, and he's worked as Director of Public Health for Stockton-on-Tees Borough Council for 4 years. Now, prior to this, Peter was Director of Public Health in various NHS posts in Teesside and the North East of England. Peter is a fantastic and long-standing advocate for identifying and addressing health inequalities and has led major public health programs in his role. So, Peter, we look forward to hearing your reflections.
Kevin, thank you. And Frank, thank you for such an inspirational lecture. I absolutely absorbed by that. And I'm very grateful, Kevin, to the faculty for inviting to make a few remarks. I'll actually start on one of Frank's comments about Morecambe Bay, where he spent a lot of his time growing up, Frank, because equally I'm from Middlesbrough. And my first EPH job, around the time you started in Morecambe Bay, was actually Middlesbrough. So I was so honoured to be Middlesbrough's Director of Public Health as well, and still in my patch, of course, in my current role. So it is a great feeling when we managed to achieve that in our careers. There's so much to pick up on there, Frank, and I think where I'd start is actually you've illustrated to people what a fascinating career public health is, and what an interesting career it is. People often ask me, why do you keep going? I say, well, actually, because each day is different, and I actually enjoy the work. And it's clear from your description of all the different roles, and I know you could have spoken for many, many hours on all the work you've done, Frank, which you haven't even touched on today, that you've actually enjoyed it and you've been fulfilled by it, and you've had a sense of real contribution to the greater good of the human race, to be perfectly honest. And that's a fantastic attribute to have. And it's a great lesson to all of us, whether it's people like me towards the latter end of my career, or to the many people in this call who are at the beginning of their careers. So in terms of inspiration, I would certainly, I'm inspired by that for the years ahead for me. And I hope people on the call who've got many, many years ahead are inspired by your love and for the profession, for the work that you do, and the sheer enjoyment that you've got from it. Amidst, of course, the frustrations we all have every day, Frank. We can't escape them, sadly. But it's absolutely wonderful to hear that. I think the second point I'd make will be a comment around the evidence-based med on your omnishambles slide. I noticed you also had the statement underneath evidence-based medicine versus empty gestures. And I think that's really poignant. In fact, I think that's far more of an interesting thing to consider as professionally. The omnishambles bit, we could have all described it in many, many ways, couldn't we? As well, and probably did at the time. But I one of the things I say when I talk to people coming into the profession, in fact, indeed, people quite experienced, is just to remember that everybody has an opinion on what we do. So I often say to people, if I was Professor Kelly talking about the latest innovation in treating a very rare cancer, they'd go, yes, Professor Kelly, of course, Professor Kelly. If I come in to talk about breastfeeding or smoking or alcohol-related harm, everybody's got a view. They've all got an opinion based on their ideology, their neighbours, their what's happening in their family, what's happening around them in their lives, their workplace. They've all got an opinion. And I learned this, and you never stop learning. There's other things for colleagues on this call. You never ever stop learning in our job. And I've learned things this morning. When I started as DPH at Stockton, which was 12, 13 years ago now, one of the very first meetings I had with the over 50s forum, and it was such a tough meeting. Because everybody there's about 50, 60 people in the room, and they all knew far more about public health than I evidently did. At least they were trying to tell me what to do. And it was a great start to DPH and local government, where all these opinions were abounding. And of course, the job of the Director of Public Health is to navigate through all of this, do the correct things to protect and improve the health of the population, give the politicians the right advice. So I was very taken by that. Just one of the reflection. I'm very interested in discussion on this. I was very taken by a lot what you described, Frank, as well, is a varied career across different parts of all the domains of public health. One of my concerns for the profession is I think there is a risk we are becoming over-specialised. And it's getting harder to maybe switch around. So I think it's great that people move careers. I am, mind you, I'm 9 years into this, so I better be careful for what's happening in the next 12 months, especially given what's going on in my world. So I'll watch out for that. But I do think there's a risk we become too specialised. A screening and IMS box and a health protection box, a health improvement box. And of course, our public health intelligence box. And of course, they all interlink. You've worked in all of those, across all of them, and bring them all together. I think that's actually the real beauty and opportunity of public health, is to knit them all together. And I think for careers, I do think we need to think about how people can actually experience at senior level as well as training level in more than one of those boxes. Because I do fear there's a risk we're becoming over specialised. And just finally, I think we need to look ahead. For the people at the beginning of their careers, Frank, on this call, what will they be doing with the next 25 and 30 years in their careers? And I think the climate change challenge is enormous. I'm doing a lot of work on healthy aging at the moment, which I think is incredibly important. I've got a vested interest in healthy aging, Frank, as you have, and I think it's something we need to do. I think we need to rethink how we actually think of aging. Aging is actually an asset. It's positive. It's better than the alternative. And I worry when I hear language around the burden of older people. And actually, older people are an asset to us, and it's a success we've got an aging population. And the challenge to us as a society, I think it's a public health challenge, is how do we utilise that asset as well. So, Frank, I could talk to you all day about this, have a discussion. I think it's an incredibly inspiring lecture from an incredibly inspiring career. And I'm quite humbled to be on the call to be able to make a few remarks. So I'll stop there, Kevin, and let other people have a word.
Oh, thank you so much, Peter, for getting the reflections off onto such a great start. And I'd like to invite our next respondent, who's Professor Nicola Steedman. And Nicola has been the Deputy Chief Medical Officer for Scotland since 2020, leading on a variety of topics, including infectious diseases, vaccinations, blood safety, chemicals, biological, radiation, and nuclear challenges, as well as public health microbiology. Now, Nicola holds an honorary professorship from Glasgow Caledonian University, with whom she's worked closely on sexual health and bloodborne virus research over many years, and she holds a membership of the Faculty of Public Health through distinction. Nicola, over to you.
Thanks so much, Kevin, and thank you, Frank. It is just a privilege to be on this panel at your distinguished lecture. It genuinely is. I've known and worked with Frank since the inception of the pandemic, since 2020. And I genuinely count myself as very fortunate, as those of you who've now heard him speak can understand, because he's been a tremendous mentor, and mentorship is something that Frank spoke about there, and also a tremendous role model, which we all need at all stages of our career. And I saw so many commonalities, Frank, with what you were saying. I was nodding away in the background, but I think that what really came out from your lecture, aside from the wisdom, is the pride and the passion that you have for what you do, and also your personality. So, so if you want your alliteration, I'm going to entitle yours Pride, Passion and Personality, all of which I think have served you enormously well through your career. And those are the qualities that I would hope to emulate. So I'm going to bring a slightly Scottish perspective to this and bring some of the commonalities in, I think, that Frank has brought out through his talk. And I think that our challenges in population health going forward in Scotland are the challenges that we all have across the UK and in fact beyond that. So our CMO has distilled it down to the 4 concurrent challenges that public health faces at the moment, which is the ongoing threat of infectious disease, and we spoke about the pandemic, widening health inequalities, which Frank also mentioned, our need to balance all of that with creating a more sustainable health and care system and the challenges that our NHS is facing as we speak, and then something also that Peter mentioned, which is the need to address the climate emergency and our planetary crisis. And I think that those are common for all of us. And the constraints in which we're working in Scotland at the moment, I think, again, there's commonalities there. The financial constraints we've heard about, our workforce constraints, both in terms of numbers, but I think also in terms of energy and motivation post-pandemic, and the other pandemic legacies that we are still dealing with in terms of the cost of living crisis and the backlog in our health and care systems. And all of this coming together creates the perfect storm of an incredibly difficult and challenging time in population and public health. So what we really need at this time are strong individuals to lead and to champion our workforce, which is what we want to try, I think, to inspire people to be through this series of lectures, apart from anything else. But I will just bring out something that Frank alluded to again, which is also that we are not just sitting in our own little island in the UK, and that the global challenges that might seem geographically very far away from us really aren't, because they impact on us in our island irrespective. And I'll use a phrase that we used during the pandemic, which goes for, I think, all of population health globally, which is that we aren't safe until everyone is safe. So I suppose it's my job as well to reflect on Frank's wonderful treatise on what it's like to work in a political environment, and as Deputy CMO for Scotland, you'd expect me to say that too. But what I will say, which I think is something that Frank said too, is that it is a privilege. It is a privilege to work in national government. And you have to have awareness and cognizance of the political arena and the ministers and their wishes, where they're coming from. But you cannot be of the political environment. And that's the key balance that we as public health advisors in government have to try to strike. And that's a tremendous dance to undertake. It really is. You have to retain the essence of your role as a clinician, which Frank clearly has. And you have to remember that you are an advocate for public health, however difficult that is. So Frank spoke about knowing when to stand your ground, which is incredibly important. And I would add to always remember whom you're serving. So that's the people. And again, Frank spoke about the need to gain public trust in these roles, as well as the trust of your ministers. The other difficulties, I think, or exciting challenges, if you want to look at it that way, about working in government, is that tension between the short-term issues and the longer-term prevention agenda that we all know is needed to be at the heart of everything that we do. And that's very difficult with short political cycles. It really is. So that is an ongoing challenge that we need to stand strong on, and I think we are genuinely making very good progress on. And Frank spoke about the changing guard of different ministers. We've seen a lot of political change in Scotland since the pandemic, but we are the consistency across that political change as the clinical advisors. So we are the backbone. And I think we're also the people to depoliticise health when it's necessary. So when political parties try, as Frank brought out in his lecture, to use it as a football against each other, and Frank spoke about that flip-flopping of political parties and how they used health to, you know, to get back at each other. And we have to be able to rise above that in our roles. And then I'm just going to finish with one final reflection from Frank, which is how to get to be a CMO. And I'd agree with him that there is a degree of serendipity. I think he's being very humble there. But he also spoke about, and I think this is what I would like to inspire in people, the desire to work within the belly of the beast. Don't be afraid to work within the belly of the beast, and also to be alive to opportunities. One of my favorite quotes is that opportunities don't make appointments. So always just keep your eyes open to that. So I think the two words I'd use to sum up working in government is courage and endeavour. And I'm going to disagree with you on one thing, Frank, which is when you say that you've been lucky. And I'll put a different quote at you, which is, the harder I work, the luckier I get. So I'm going to finish by just giving a few bits where I think we have hope. We know what we need to do in public health. We just need to keep on plugging, get on with it and do it. And public health is everybody's business. So maybe we need to step out of our silo and reframe that going forward. But I think we have the dedication and the passion and the desire to serve within our workforce and within our senior leaders. And Frank has exemplified that today.
Nicola, thank you so much. A fantastic reflection and really pulling out and building upon Frank's reflection on working in government and working with politicians, which is one of the objectives of this session today, because we really want colleagues to leave this session being inspired about, as you say, getting into the belly of the beast. I think that was the metaphor you used, but being part of the change that we want to see and not to be shy or to be afraid of stepping forward and leaning in to leadership at every level of the system, and recognizing that whatever we do, it will be political. So we might as well get good at being in that space and doing that as well. So getting in there. All right, our final reflection then is from Clare. I'd like to welcome Dr. Clare Oliver Williams, who is a public health registrar. And during her training, Clare has led impactful projects on subjects including antimicrobial resistance, fuel poverty, and regional differences in breast cancer screening outcomes. Now, beyond her training, Clare contributes to the academic development of future public health professionals as an honorary member of Cambridge University's Public Health Education Group. Clare is the co-chair of the faculty's Specialty Registrars Committee and Global Violence Prevention Special Interest Group. Clare, welcome. Thanks for being here, and over to you.
Thank you so much. And just to reiterate, it's such a privilege to get to be here today and to reflect on the insights that Professor Atherton has shared. His talk, his contributions spanning decades and continents as well, really highlights kind of the critical role that public health can play. And from that talk, I'm really going to reflect on what registrars can take away from that, because that's the position I'm standing in. And there's 3 points that really kind of sung out to me. So the first is that kind of need for political awareness, for political acumen as well. From all the way back when you were working at the International Centre for Diarrheal Disease Research, and that just being cut suddenly all the way through to being CMO. That not just having those technical skills, which the training program really grounds us in, it makes sure that we have all those experiences, but also stepping up and understanding that strategic engagement with policymakers. And as you said, not over-promising to them at the same time. So I really think it's important for registrars to seek out those opportunities and step into those spaces where possible. And as you said, get stuck in, actually don't just advise, but do the work as well. Secondly, you talked a lot about kind of that advocacy role, your CMO reports, covering some kind of hot topics sometimes quite early on compared to other areas. And I think that it's a really, really important point for registrars advocacy. In fact, it's one of the whole work streams of the Specialty Registrar Committee, because so many of us feel that it can be really challenging. We can feel quite constrained by the environments we're in. So it's really kind of inspiring to see how you've kind of put things out there and how you've drawn lines and said, this is actually something that I'm going to hold on to and I'm not going to compromise on that, but also picking battles as well. So I really think for registrars, we need to figure out how we can own that space, how we can be comfortable doing that whilst also not fearing for things like our jobs, which is actually genuinely some of the discussions that are had. And then finally, really resilience and adaptation is what kind of sung through. As I said, you've moved through so many different roles in so many different locations, and the political landscapes have been vastly different at times, but you've sort of sought and you've found avenues for working in public health and improving population health, and that kind of adaptability and that ability to keep progressing when there was so much flux around you really struck me. And of course, you had so many kind of different poets and poems and musicians in there. So I think I ended up sort of picking a quote to finish up with. So I think the takeaway quote for me from you is to seize the current, as you said quite early on, is to take opportunities when they arise and just move things forward. Try not to get too kind of bogged down in one particular idea. So thank you very much.
Oh, Claire, thank you so much. A wonderful perspective there from yourself. And also thinking about how, as you know, in the conversations that you and I have, Claire, I'm always interested to understand how you're viewing the world and the career ahead of you, because we can describe it in terms of complexity and challenges, but we can also describe it in terms of hope and opportunities. So Frank, I'm going to open up now the questions to the entire panel, and I'm really pleased to say we've had quite a number of questions coming in the chat and in the Q&A. So I'm going to pose a question to yourself, Frank, and I'm going to ask one person from the panel to respond. And this is a chance for some brief responses from everybody so we can get in as many questions as we can. So the first question is going to be on resilience, and the second question is going to be on neutrality. And for the first question, Frank and Peter Kelly, I'm going to start with. And it's this issue of hope and optimism. One of the questions coming in is just about how, for many of our colleagues, especially coming out of the pandemic, feeling tired, disengaged, disempowered, and demoralized, people feeling that here we are again going through change and structural change and having to argue the case of public health. What is the space for us to find that hope and optimism within this change, or maybe to be a little bit more resilient in how we can navigate these changes? Because this is not only are we seeing changes, but the pace and the frequency with which changes are occurring seem to be accelerating. So Frank, any words of wisdom from your career and how we navigate this? And Peter, I'd love to hear your reflections too. Yeah.
Well, my starting point for this would be, in our careers, in our working lives, in what we do, there are always going to be setbacks, knockbacks, but things do get better, over time. You remember I talked about that kind of massive change in Bangladesh when the whole program, we'd invested massive amounts of resources into the Bangladesh government to make things better, and it was all just knocked back. But it didn't go back to where it was before. It went back to a little bit better than it was before. It's that sawtooth kind of progress of society, sawtooth progress of improvement. So things are getting better, and that requires us not to lose heart, because we need to keep that in our view. I remember when I went through that process, we were summoned by the permanent secretary of the Ministry of Health, who was the incoming government. We were summoned the donors, the kind of lead agency, the donors. I just remember this, Kevin. And we were summoned to a dinner, and we had dinner, and he just lambasted us. It was a little bit, not quite as bad, but it was a little bit like Vladimir Zelensky in the White House. It was that kind of an environment. You couldn't eat your food. I mean, it just wasn't, it was just awful. And I remember kind of leaving that thinking totally dispirited. And I wrote it was those when you wrote telegram. I wrote a telegram back to the Foreign Office, just to kind of just to remind myself that it wasn't all doom and gloom. But things did kind of get better. We got back on track. So there is always hope. You've got to always remember that things do get better.
Yeah, thank you, Frank. And Peter, we've been through a bit. So what's your top tip here? Yeah.
Okay, so I think first of all, resilience comes in many layers. I think people in leadership positions have responsibility for their own personal resilience, but also for the resilience of the people around them.
Mm-hmm.
So the pandemic, we could all tell our stories of the pandemic. And one of the things I did with my staff, as PHE was broken up, and then we all moved. It was hard times, and I got the staff in a room, face to face in a room by then. And I started off by saying, "You have saved thousands of lives. You have saved thousands of lives, and thank you."
Mm-hmm.
All the nonsense, all the criticism, all that stuff, park all that. You have saved thousands of lives. And that, I think, is incredibly important to make our staff feel good and to be aware that they might not be saving staff on the front line with ventilators or in hospital wards, but the work they did saved lives. So I think there's a responsibility in a leadership position to build resilience into our teams and our people. On a personal level, I think this is where we professionally need to look after ourselves. I think we need to care for ourselves, our own resilience, our physical and mental health and well-being. It goes down to the Stephen Covey's 7 Habits of Successful People. One of them is looking after yourself, and actually, that's really important, physically, mentally, relationship-wise. And I had a like all of us. I'm sure we all had some tough times. I had a really dark moment of the pandemic in October 2020. I've been on yet another call with Secretary of State, been hammered for some of the stuff in my region, and it was difficult. And I came off, and I was almost in tears sat in my office.
Mm-hmm.
And there was a couple of people there because we were all spread out with the small people there. And she sent me the Theodore Roosevelt Man in the Arena. Now, it wasn't one, I don't know whether Frank's aware of this one, but look it up, The Man in the Arena by Theodore Roosevelt. It's an amazing little statement. It's not the critic who counts, nor the man who points out how the strong man stumbles, or where the doer of deeds could have done better. The credit belongs to the man who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs and comes short and tries again. And it goes on. And that motivated me. I incredibly moved. The person who sent me that was having an incredibly hard time herself. And so resilience, we were there for each other as well as after ourselves. So it's a great thing in the profession.
Thank you both. Now, I didn't think that we'd be integrating public health and literature and poetry today, but I am loving where this is going. So Nicola and Frank, the next question is to both of you. And this is one about being neutral. In an environment where the world is becoming increasingly polarized, how do you, in political spaces, maintain the supposed neutrality when actually there is a truth? There is an evidence that allows us to base and have better decisions. But how do you operate within that when the objective reality, nobody's listening to experts, we have alternative facts and so forth. So just any brief reflections, starting with you, Nicola, and then I'll come to you, Frank, on navigating that space, because that is becoming part of the post-truth world we're living in. And how do we deal with that? So, Nicola, what are your thoughts on that?
So if you want my thoughts on actual neutrality, then I'm a scientist at heart. So I'm follow the evidence, and I really am. And I think if you have the evidence there, that is one of the strongest arguments that you can make. It's very hard to come back against something that's scientifically backed. However, in terms of our own roles as people with opinions and views, then I think we have to remember again who we're serving. We're serving the population. We have advocacy at our core, and to remind yourself of that on a regular basis, that it's not necessarily about you. It's about what the evidence shows, and it's about what's best for the population, and always have that in what you're trying to do. I think recognition and self-awareness is incredibly important. We aren't neutral as individuals, so know when you're potentially in a weak spot because you have a particular individual experience or a bias. Know that, see it, and either, if you can, mitigate for it, or if you can't, step back and let someone else who doesn't have that emotional involvement in something take the lead. It's very important to do that. And in our own way in government, we're not neutral. We are trying to usually put forward something that we know is the right thing to do. So actually not being neutral is not necessarily a bad thing, because you are trying to, be the proponent for something that is the right thing to do. And I think I'd finish dangerously by talking about something to do with the red lines, which you asked Frank about. So I think that's the other thing. We can't be completely neutral. We will have our red lines, and we do have our red lines. And I've had them in my career where I've had to step away and not be seen to back something that I didn't believe in. So we could talk about that all day, but I think those would be my reflections on neutrality. It's complicated and it's nuanced, and self-awareness is probably the most important thing.
I love what you said, because often we think neutrality means that we have no position at all, when the converse is true.
Yeah.
Neutrality for us is that we actually have a position, and we need to, as you say, be humble to recognize that we have parameters, values, opinions, the evidence that allows us to have this place of neutrality. But it means that we're intersecting with other people who feel equally justified by their views, and it's how we navigate between the two. Now, Frank, you probably had to deal with this on a number of occasions. Any top tips from you on
Well, it's
this?
a couple, really. I mean, you said it right at the outset, Kevin, that public health it's a political field. We're working in a political field, but we have to distinguish between being political, which we are, and not being party political, and that's a really important distinction. But on that, I think it's important to kind of engage with politicians of all stripes. Perhaps, well, lunatic fringe, but you know what I mean. And actually, if you want to influence the environment you're in, you need to engage with the politicians of the future, not just the politicians of the present. So, as in the ADPH, when I was leading the ADPH, of course, we always tried to meet the leaders of the opposition, people who might be ministers of the opposition. And just two other thoughts. The other point about neutrality is we root our decisions, yes, in evidence, as Nicola says, but also in what makes a difference to people's lives, and that is our kind of strength. Can I just one final thing? I remember talking to Sir Liam Donaldson about this, and I was asked, it was at the time when he'd been trying and failing to get smoking ban in public places. And I remember asking him, how can you carry on when the politicians are just not listening, and people are dying and unnecessarily, and what do you do about that? Do you not think about stepping down? And he was very wise, actually. He said to me, yeah, Frank, he said, you only resign once. So use the tools in your box, but use them wisely. A word of wisdom from Sir Liam.
Indeed. I think I have engraved that on my palm as well. So as a reminder. All right, we have 5 more minutes left. So Claire, I'll start with you for this one, and Frank will finish with your final reflections as well. And it's about advocacy, right? About our advocacy voice. And in an environment where we know advocacy is a cornerstone of public health, and given the fact that there are so many issues happening at the same time, pandemics, geopolitics, cost of living crisis, etc., what does it mean for how we amplify our voices, where we focus our energy? From your perspective, Claire, anything you're seeing in terms of what people are doing now that can help you to think about what the future of advocacy may be? And Frank, any lessons from your career in terms of focused advocacy for impact? So Claire, I'll start with you on on advocacy.
Sure. Yeah. Thank you. So I think the first thing that comes to mind is actually being really grounded in public health practice, because actually things like tackling health inequalities, that's the core of what we should be doing, and that in and of itself is advocacy. So there's the kind of there's the given advocacy that we're meant to be doing every single day in our roles in public health, and then there's the much more public kind of advocacy that can happen, where we have, fantastic public health professionals, registrars, consultants higher up who do very public pieces of work advocating for very specific kinds of issues that might be safer screens, commercial determinants of health, smoking, any number of different things. And I think when it comes to that kind of thing, one thing actually that a number of people have said in here is actually it's knowing people and having a network to support you. Peter put it very eloquently when he spoke about that really difficult phone call, that actually having other people on your side who can support you, because it can be very difficult. And I say this, and having never actually done it myself really, but it looks extremely difficult to stand up very publicly and say you are for or against one particular thing, knowing that you can get some flack thrown at you from someone somewhere. So having those people who have your back, I think, is essential. And just that resilience, coming back to it again, is so essential, looking after yourself. But yeah, those are the first things that come to mind, at least.
Well, listen, fantastic. And when in the conversations I have in the faculty, I always say, remember, we have many tools in the advocacy toolkit, and not everything needs to be shouted from a radio station or a TV station at 6 p.m. We can write letters, we can work with SPADs, we can engage with politicians, we can engage through the academic literature. Understanding the tools we have to advocacy and the nuance in how and when we use them, but to do it strategically, is perhaps a way to think about the opportunities that we have. And that's going to become incredibly important now as we're going through lots of change. But Frank, I wonder if you agree with my analysis in terms of the sophistication in how we think about advocacy.
Yeah, we need to be very sophisticated. We need to layer our messages, appropriately for different channels. But 2 points that I'd make, if I may. The first one is, know your enemy. Yeah. Know what kind of arguments are going to be wielded against you when you're advocating for an issue. And sometimes we're not as astute at that as we need to be. If we think about the tobacco, the reason tobacco work, we wanted to get to a stage where we had smoke-free outdoor places around pubs and clubs, etc. But the industry got ahead of us, and they did their advocacy very, very well, and they probably did it better than we did as a community. So that's a battle we need to kind of go back to. And the other one is, it's back to that question of anger, really. Politicians are not in the space of wanting to create public anger. They don't want the public to be angry, but sometimes we do, and we need to generate public anger. It's right with the commercial determinants of health. If people really understood the kind of addictive nature of pop and tobacco, of course, and all of these things, and they really understood how industry was manipulating their behaviors, and if we can explain that in a way that people can really understand, and in a visceral way, then public anger can be wielded to public good, public health and public good. But that's not something that politicians are particularly interested in, because they want votes. They don't want angry voters. Yeah.
Well, colleagues, we've come to almost the end of the session, and I have to say the chat is both reflective and emotional. I think, Frank, what you've done is to enable an authenticity and an honesty in the conversation that we've had today about leadership, and in a sense, it's an example of who you are as a leader, and the fact that you've allowed us the space for people, and Peter, and in fact, all of you have shared of your own experiences and brought those experiences to the table today is both magical and special and important for us. Frank, when we think of public health leaders and leaders at chief medical officer level, you often think of you have to be a certain kind of person to lead. And I think yourself and Nicola in The Beast of the Belly are showing actually you don't need to be a hard man. Sorry, Frank, maybe you consider yourself to be a hard man. I shouldn't say that. But, we bring different kinds of leadership skills to the table. And Frank, just in closing, I wondered if you wanted to reflect on what it means to be an authentic leader, how you have been on your journey with leadership and what your hope is for the specialty as you now move to that next phase of your journey. So Frank, a closing comment from you. Thanks.
Well, thank you. It's always been about the teams, and actually Peter said it very, very well, you know, about kind of listening to people around the teams and getting the best out of people around. Is that one of the greatest joys of my life has been seeing people develop, you know, and listening to people and watching you know, some of the trainees we've had sort of kind of come on into senior positions. So don't kind of lose sight of that as a way of remaining inspired and excited about life. But yeah, get angry, but keep your anger to yourself and channel it well.
Channel it well. Well, colleagues, we've come to the end of today's Faculty of Public Health Distinguished Lecture. Please join me in thanking our panelists today, Clare Oliver Williams, Nicola Steedman, and Peter Kelly for doing a fantastic job as respondents to our wonderful lecture by Professor Sir Frank Atherton. A reminder that all of our distinguished lecture series are recorded and are made available to faculty members. Please continue to engage with the faculty. We've created many opportunities for us to learn together, to share our experiences, and to ensure we continue to build a community as practitioners in the service of improving health and tackling inequalities. As always, we'll be evaluating this session, so we look forward to hearing your comments and thoughts on how we can improve these distinguished lectures. And we're always open for suggestions for great speakers that you'd like to recommend for these sessions. So please do send them in. And finally, a request to Sir Frank that if you have any books that you'd like him to read, please send them through either to him directly or to us at the faculty, and we'll make sure to get it through to them. So Frank, thank you so much for being with us today, and thank you so much everyone for joining us. Take care.